record on. Okay, we're all here.
We're all here.
But how did we get here?
How did we get
is
here?
the question.
Hip pain and deadlifting. So let's see. You all right? You're good? You ready to go?
No, hold on. It's not. Just nobody needs to know. Tissues are somewhere.
Tissues. Oh my God. When JD was sick last week, we literally filled a full brown shopping bag filled with tissues. My mom was just chasing him around, wiping his nose all day, and the whole bag was full. But in any event,
Yeah, he was like throwing snot all over the place.
Oh, it was so bad. It was like slime coming out of his nose. It was like, just like
Trent, that's what you have to look forward to.
Yeah. And then he would come up to me and be like, wipe my nose, please. So welcome back to the Progressive Rehab and Strength podcast. I'm your host, Dr. Rory Alter, clinical coach here at Progressive Rehab and Strength, with my lovely co-host, as usual, Dr. Alyssa Havison. And we're here with another 10-minute tip Tuesday. And in this episode, we're talking about the deadlift and hip pain. I would definitely say that the deadlift is not as common of a place to experience hip pain as the squat. However, we do tend to see hip pain with the conventional or with the deadlift. So I'm going to set a timer for 10 minutes if I was on the right app.
And I would say if there is hip pain in deadlift, it's likely that there's also hip pain in squat, but not 100% of the time.
Yeah. I would say the majority of the time that if you have hip pain with the deadlift, you will that person probably has hip pain with the squat. But it is not always the case that a person who has hip pain with the squat will have hip pain with the deadlift. So here's our 10-minute timer. 10 minutes. And we're going. So Alyssa, there's two types of deadlifts. We all know this, but if you don't know this, there are two types of deadlift: the conventional deadlift and the sumo deadlift. Conventional deadlift is with your feet under your hips and your hands outside your legs, and the sumo deadlift is with your feet outside your hands, so a wider stance. And your hips tend to be more externally rotated. And I'm just giving you a brief rundown on that. We have 10-minute tips on the conventional and sumo deadlift. But for anybody who's just joining us and doesn't know what the difference between a sumo and conventional deadlift is, we've got 2 episodes on that. So Alyssa, in the conventional deadlift, where do we tend to see hip pain?
In the bottom position. So when you're getting set up, and
also known as the start position.
Yeah, the bottom.
We talk about
it as
the
long
bottom.
day.
I know we've recorded 8 episodes today, so don't worry. Bottom
the
position,
start position for the deadlift. And there's a couple things to consider. So, and before we talk about stance and foot position or toe out angle, I do want to touch on like hip height and making sure that you're in a proper optimal starting position.
Right.
So the bar should be over your midfoot. And if the bar isn't over your midfoot, you're not set up to perform an efficient movement and move that bar in a straight vertical line.
And we will refer you guys to our podcast episodes and our YouTube video. So I'll link those in the show notes on the deadlift technique that we recommend. So that should be your start position. You got to check that first because the lower your hips are, the more.
Yeah. So the reason I'm mentioning this is if the bar is not over your midfoot. So usually what we tend to see more of is the bar is in front of the midfoot. Then shins are touching the bar, which they should be touching the bar, but we want the bar over the midfoot. And then the hips are too low. So now we're setting up with the hips too low and more knee flexion,
more hip flexion,
more hip flexion.
Crowding.
Yeah. So we have to look at make sure that that's all good before moving on from there. But then it's a foot placement that is going to be the next sort of trial and error aspect of the lift that we'll tackle. So making sure that your feet aren't too close and toes aren't too turned out, or in a conventional deadlift still not too wide and toes forward. That's where we tend to see more symptoms. So you know, getting set up. Sorry,
You right
something's in
over
my
That's okay.
eye. S setting up with your feet about hip width apart, and and some toe out angle is usually a good starting point when you're playing around with your foot position. I say playing around because with hip pain, it really is this trial and error process usually to make sure that you're getting your feet at a width and a
Mhm,
toe out angle
mhm,
that's
mhm.
comfortable for you. So I'm not going to give one right answer here. Um,
Yeah, no, and I think that's key is, we have this start position, but that's like the starting technique that we recommend. And if someone's experiencing hip pain, there's some people who respond to heels really, really narrow, toes really, really turned out. And there's other people like me in the conventional deadlift. And I have a couple clients who I need to do this with because of their just hip anatomy and what's comfortable for them in the deadlift, where we turn bring the heels much wider than we would typically recommend and have the toes a little bit more forward in that conventional deadlift. So you got to play around. If you're having pain in the typical position that we recommend, then you've got to play around with your heel width, and your toe out or toe forward position. Um, Now, if we are experiencing symptoms if we've fixed that, where do we go from there in the conventional deadlift? If we are played around and there's literally no foot position that we can find that relieves our symptoms, how might we continue to train the conventional deadlift?
so we can add rack pulls or block pulls, elevating the bar above the range that is uncomfortable, so that you're kind of cutting that range out of the lift, uh, and and reducing the load. So
Hmm.
obviously we're at that point because lightweight was a problem,
Right. Right.
that we're gonna shorten the range. So progressing the load and then reducing the load when it comes time to increase the range and then continue to
Right.
progress it.
Yeah, the other thing that I like, if someone, I would go to the rack pull first, the rack or block pull first. But if that is still kind of out of the question for someone, we can do a Romanian deadlift, because that keeps the
Mhm.
hip a little bit more open because we're not bending the knees. So it's hurting. It's the start position that's uncomfortable. It's that hip flexion that is uncomfortable. And when you do the RDL, you have less hip flexion because you're really not bending the knees much in the RDL. So if the block pull is still out of the question, then maybe we do RDLs for a little while. Then we move to the block pull. Then we lower the range of motion for the block or rack pull, and then eventually, hopefully, get back down to the floor. And our hip has calmed down enough that we can utilize whatever stance is comfortable to then pull conventional. The last thing, like if you still want to kind of train this conventional pattern, you can utilize the RDL along with uh, it's been a long day. We've recorded a lot. Barbell bridge, not a hip thrust. Those your hips are elevated on the bench, but when you do the bridge from the floor, you can load a barbell bridge much heavier than you can load an RDL, so you can still get that kind of overload for the hips if you're not pulling from the floor. Now, let's say someone is a sumo deadlifter and they're experiencing symptoms in the sumo deadlift, and I in their hip, and I typically tend to find that someone who has hip pain in the deadlift, if we took 10 people and said these people deadlift and have hip pain, I would say more of them would probably be um, that's a lie. Let me go back a little bit. The sumo deadlift, typically people will have pain at lockout in their hips. And in the conventional deadlift, people will tend to have pain in the start position in their hips. And the reason we have more pain in the lockout position on the sumo deadlift is because of the hip being loaded in this externally rotated and abducted, meaning the leg is further away from the body. So when we load the joint in that position, it's a little bit more irritating to the hip joint. So when we're at lockout, we can experience hip pain there, and when we have kind of like this impingement syndrome, we can see that in the conventional deadlift. So how might we modify the sumo deadlift to account for pain? Both in the bottom position, if there is bottom position symptoms, or at lockout.
Yeah, so again, we have to look at start
Mm-hmm.
position where the
Mm-hmm.
bar is, and then also foot placement, like stance width and toe out
Mhm.
angle. So
Mhm.
sometimes we see these really, really wide sumo positions, and
Mhm.
that's not necessarily ideal, or really wide stance with toes forward,
Mm.
which can also be problematic.
My hips hurt thinking about
And
that.
and those sumo can be aggravating for hips that are upset potentially. I just
Mhm.
want to say that if you've exhausted everything with conventional and you've gotten the bar back down to the ground,
Mhm.
it's
Mhm.
not it's all fair game. So with either one of those, going and trying the other one to
Mhm.
see if like,
Mhm.
hey, like maybe your hips feel better in general to train sumo and
Mhm.
progress it. It's that is also fair game for, if you've exhausted options with conventional. But anyways, back to back to sumo. Um, so, and then again, if there are symptoms off the ground, we can elevate the bar, rack pulls. If there are symptoms at lockout and we've adjusted the feet and all of these things, because again, adjusting the feet in the start position isn't just to address symptoms in the start position; it's still going to change your position at lockout.
Mhm.
Um, a halting deadlift, shortening the range of motion. Those are all options. And then we could train a conventional deadlift. Uh,
Bada bing, bada boom.
and if you're not training a conventional deadlift and you're training sumo and you don't have any known history of problems with conventional deadlift, maybe
You
you should also
still
be
should,
training a
yeah.
conventional deadlift anyway.
Yeah, no, I totally agree. So I mean, just to kind of like touch there, we have 34 seconds left. Uh, so interestingly, and I'll talk a little bit about this when we do the episode on my hip slash back injury. Um, I'm someone who experiences back pain with extended periods of conventional deadlift and hip pain, both in the conventional deadlift and with extended periods of sumo deadlift. Um, Most people, once they get to the intermediate and advanced stage of lifting, need to uh, deadlift twice a week to make progress. Timer's up, but I'm going to keep saying what I'm saying here. So, for someone who has back pain and hip pain in different deadlift lifts, what can you do? Well, one thing that you can do is look at frequency that you're training the lift. So maybe someone who experiences hip or back pain can tolerate one time per week for that lift, but they need or of the irritating lift, but they need 2 days. A frequency of 2 times per week in order to make progress in that lift. We can do one of both, and we can also play around with like different variations as well. So maybe someone, maybe you're doing an RDL for a while, or you're doing a rack pull for a while, or you do short bouts of the main lift, and then just to kind of keep your symptoms at bay. So once you're kind of out of this novice stage of lifting, you really, like, obviously, like, we want to train the main lifts as much as we can, as regularly as we can. But if you need to pull them out, or you need to alternate which one you're doing, because you can't do it as frequently because that's when your symptoms start to flare up, totally fine. I'm a person who always, I do best when it's a mix of sumo and conventional. Um, so my back will flare up more when I'm doing conventional too much, and my hip will flare up more when I'm doing sumo too much. So, just an aside, if you kind of see that in your lifters or in your patients or yourself as an athlete. But that's it for this 10-minute tip. The hip is, I love the hip so much, even though it causes me so much grief in my own body. um, and I know, Alyssa, you enjoy working with the hip as well too. So again, if you guys need form checks, advice on your technique, if you need help with pain or injury and barbell training or powerlifting, you can join our free Facebook group, The Secret Society of Barbell Mastery, where we do form checks every Wednesday and Friday. We do live Q&A sessions in there and record live podcasts in there sometimes as well. And you can book a free consultation with any of the clinical coaches here at Progressive Rehab and Strength. If we're not the right team or of coaches or clinicians to help you, then we will definitely provide you with advice on where to find the help that you need and some things that you can take along with you to start implementing, even if we are not the best fit. So these free consultations are not just sales calls. You walk away with education and opportunities that you might not have been aware of, even if we don't end up working together. So definitely book a free consultation with us. We'd love to help you in any way that we can. And all those links are in the show notes. So we will see you next time, guys. Bye for now.